I'm Kelsea McCabe, and I'm going to be doing the exam today. Hello, my name is Kelsea. I'm going to be your nurse today, and I'm going to be doing your exam. Could you verify your name and date of birth for me?
McCabe, 12/26/2000.
Okay. I'm going to do hand hygiene and put on my gloves. Alright, so first I'm going to inspect your facial features for symmetry. So everything looks symmetrical and good. Okay. Now I'm going to assess cranial nerve 5, which is a trigeminal nerve. So could you clench your jaw for me? And then I'm going to palpate. Okay. Now I'm going to do the cotton wisp test. Feel that? And on this side? Good. Okay, now I'm going to do cranial nerve 7, the facial nerve. So could you squeeze your eyes shut for me and raise your eyebrows? Good. Alright, now I'm going to palpate your scalp and head for any lesions or abnormalities. Okay, now I'm going to palpate your sinuses. So I would palpate the frontal sinus and the maxillary sinus. Those are the only two palpable sinuses. And now I'm going to have you open and close your jaw for me. I'm palpating the temporomandibular joint, looking for any clicking. Everything looks good there. Okay, now I am going to palpate and auscultate your temporal artery. So I'm going to palpate. Good. Now I'm going to auscultate. Alright, everything seems good there. Okay, now I'm going to inspect your neck veins. Your neck looks good. I'm going to palpate your carotid arteries one at a time. Okay, good. Now I'm going to palpate your neck. So first I would do your trachea. So I'm going to palpate the trachea. It should be the midline of the neck. I should be able to hook my index finger on either side. Good. Okay, now I'm going to palpate your thyroid. So could you tilt your head back for me and swallow? Good. Okay, now I'm going to, could you tilt your head to the side? Going to displace with my thumb and palpate. And then the same on the other side. Displace with my thumb and palpate. Good. Now I'm going to assess your lymph nodes. There should be 10 of them, and I am going to palpate with a gentle circular motion. So first I'm going to do preauricular, posterior auricular, occipital, submental, submandibular, jugulo-digastric, superior cervical, deep cervical chain. So could you tilt your head for me? Down the chain, other side. Good. And then posterior cervical. And then could you hunch your shoulders for me? Supraclavicular. Alright, everything looks good there. Now I'm going to assess cranial nerve 11, which is the spinal accessory nerve. So could you shrug your shoulders for me? And tilt your head. And tilt your head. Good. Alright. Now I am going to assess your eyes. So first I am going to assess your eyes for symmetry. I'm going to look at the lacrimal glands, the pupil, the iris, the eyelids, eyebrows, and eyelashes, and the optic. Okay, now I'm going to palpate, and I'm going to look at your conjunctiva. So could you look up for me and pull down? Good, everything's good there. All right, now we are going to assess cranial nerve 2, which is the optic nerve. So first I'm going to do the Rosenbaum functional vision test. So could you hold this over one eye for me? And then could you hold this 14 inches in front of your face and read the smallest line that you can?
374258.
Good. And same on the other side.
374258.
Okay. And it should be 1414 in both eyes. Alright, now I'm going to do the confrontation test. So could you cover one eye for me? I'm going to cover the opposite eye and tell me when you can see my fingers, okay? Good? Good. Okay, other eye. You can put your goggles back on too. Okay, now I'm going to assess cranial nerve 3, which is the oculomotor, cranial nerve 4, which is trochlear, and cranial nerve 6, which is abducens. So first I'm going to do the corneal light reflex. So I'm going to hold my light pen over the bridge of your nose, and I'm looking for a reflection in both eyes. Good. Okay, now I'm going to do the cover test. So could you cover one eye for me? And now uncover, and then cover one eye, and uncover, looking for movement of the opposite eye. Good. Now I'm going to do the 6 cardinal fields, so follow my finger. Good, and that is also called the H test. Okay, now I am going to test your pupils. So I'm going to dim the light. And now I'm going to hold my light pen directly over one eye. And then the other eye. This is the pupil response to direct light. Good, and I'm also looking for pupil response to consensual light in that same test. So when I hold the light over, the pupil should constrict, which it did, and then the other eye should also constrict. Okay, now I'm going to do pupil response to accommodation. So could you stare straight ahead for me, and then shift your gaze. Good, okay, everything looks good there. Now we're going to move on to the ears. So first I'm going to palpate your ears and the external auditory meatus. Everything looks good and symmetrical. Okay, now I'm going to use my otoscope, and I'm going to use the largest speculum that will fit comfortably in her ear. Now I'm going to pull the pinea up and back and look into her ear at her ear canal and tympanic membrane. Okay, now I'm going to do the same on the other side. Up and back. Okay, and the tympanic membrane should be a pearly gray translucent color, and the light should reflect at 7 o'clock in the left ear and 5 o'clock in the right ear. All right, now I am going to do the functional hearing whisper test. So if you could turn to the side for me. I am going to palpate the tragus of one ear and whisper a series of 3 letters and numbers into the other ear, and she's going to repeat them back to me. And I'm going to stand at arm's length behind her. Okay.
1A2.
Good. And now the other side.
1B3.
Good. And normal results from that should be she should be able to repeat back to me 3 to 4 sequences of letters and numbers. Okay, you can turn back towards the front. Now I'm going to assess, and that would be assessing the auditory, cranial nerve 8, which is the auditory nerve. Now I am going to do the RIN test. So I'm going to use my tuning fork and put it behind your ear on the mastoid bone, and you're going to tell me when you can no longer hear it, okay? Okay, now the front of the ear. Okay, and then now I'm going to do the other side. Okay, and it should be a 2-to-1 ratio. Now I'm going to do the Weber test. So I am going to strike my tuning fork above her head, and you're going to tell me if you can hear it equally in both ears or in one ear better than the other ear.
Equally.
Good. Okay, everything looks good and normal, and you are all set, and that concludes my exam. I would do hand hygiene and document.